Are you having difficulty lifting your arm overhead or having shoulder pain? If so, this video may be for you. Hi, I'm Alicia, and I'm a registered physiotherapist. In this video, I am discussing our active recovery systems featuring self-cupping release. By the end of this tutorial, I hope you will learn a little bit about the purpose of cupping, how to apply it to this area of the body, and different techniques to use for self-treatment. The lats, often thought of as the swimmer's muscle, extends from your mid and lower back up to your arm. Overactivity in the lats tends to limit overhead movements of the shoulder girdle. Therefore, I recommend placing the cup at the bottom edge of the armpit or axilla. Start by applying some form of lotion or oil to the skin. Gently lift a small edge of the cup while pushing down on the top button. This should anchor the cup to the skin. Pull up the button to get the suction. This cup placement strategically focuses on allowing for and creating separation between the scapula and humerus, which is needed for adequate overhead movement. Start by reaching your affected arm up overhead. You can add a little side bend for an added effect. I am using suction cup therapy to help improve the quality and quantity of movement of my shoulder and scapula. The cups provide tissue distraction or a pulling away of the skin. This novel stimulus to the body may help to reduce the overactivity of the nervous system, which often presents itself in the form of pain or tension in a muscle. In this case, it may be limiting your ability to reach your arm up over your head in a pain-free way. Next, you can try overhead elevation in a supine position. Bend the knees so that your low back stays in contact with the ground. Have your palms facing you. Lift your arm up overhead, reaching your fingers towards the ground. You can add a contract and relax strategy here for an added effect. You can hold each contraction for approximately 5 seconds. Self-cupping may cause a bit of bruising, but this is not the goal. If possible, we want to avoid the bruising effect. Leave the cups on for no more than 3 to 5 minutes per location to minimize the chance of bruising. After reaching the arm up overhead, you can change the angle of stretch to go across the body. You can repeat the contract and relax technique in this direction. Working across the body can also help to improve the separation between the scapula and humerus, which is needed to achieve adequate and pain-free overhead elevation. These examples of treatment strategies are being demonstrated based on the patterns we recognize to be helpful within our practice. However, you should do what feels right for your body. Cupping should be comfortable, and you should notice a change in how the body feels afterwards. Finally, you can perform overhead shoulder movements while lying prone. Reach that affected arm up overhead with the cup placed just below the axilla. I find that moving the shoulder into elevation in this direction to be quite helpful at improving the quantity of movement. Add the contract and relax if you are comfortable. As always, as a precaution, we advise that you speak to your treating healthcare professional before using cupping. This is to ensure that cupping is a safe form of treatment for you. I hope you enjoyed this video. Thanks for watching. We hope to see you again soon.